Good day, everyone. We'd like to welcome you all to our CMI webinar. We are going to be discussing a very important topic today. We would like to especially welcome our guests who are watching us from Manila, from Europe, and from Singapore. Hello, everyone. You know, this has become a truly global topic. You turn on the TV, every news channel is discussing COVID. And now as the whole world is trying to emerge from isolation and lockdown, we all ask, what is it going to be? How is it going to be? And in particular, how is it going to be for the seniors out there? So here in CMI, we put together our experts so that we can guide all of you as you take care of yourselves, your parents, your grandparents after quarantine. May I have my first slide, please? Next. Okay. In the history of our generation, we have never seen an epidemic like this. Once in a while, we would hear some news about some epidemics in some selected parts of the world, but never in this range. There are more than 4 million cases of COVID-19 in the whole world now. Almost 300,000 people have died, and 75% of these are more than 60 years old. If a person has cardiovascular disease, hypertension, and diabetes, there is a higher chance of them dying from COVID-19. That 8 out of 10 of the deaths worldwide occur in these people with comorbidities. So the serious fact is seniors are the most at risk in this condition. We have seen respiratory viruses, particularly coronaviruses, coming out in our history. We had SARS, we had MERS, but now it's COVID-19. And it has really affected everyone. Either you got people who got sick, people who were being observed, or people who had to be on lockdown and had to stay at home and wait until they are given the clearance to go out again in this world. So today we're going to address the question of how is life going to be for seniors after quarantine. Next. Next slide. Okay, so in some places of the world, they're totally locking them up. In some places, there are only certain periods where they allow seniors to go out. I know that in Manila, there was a huge uproar because there are so many seniors who were already, who are still very active, managing their businesses, and those who are living alone, they need to go out and buy their own groceries. You cannot lock down the seniors. A lot of them are still very active, and you cannot confine them all the time. But how do they navigate? How do they safely navigate the world out there now with all the viruses floating around? Okay. So we begin our discussion today, our webinar, and these are our house rules. Next slide, please. We will be muting everyone's microphones so that we do not distract the speakers, and we will turn off all your videos for the duration of the webinar. Now, for any questions, please feel free to type them in the chat box. Make sure you include your full name so that I could acknowledge you when I ask your questions. We will be choosing which questions to ask from your questions during the Q&A. So let me begin with introducing to you our speakers. First speaker is no other than the past chair of the Philippine Subspecialty Board of Geriatric Medicine. He graduated from the Pamantasan ng Lungsod ng Maynila for his medical degree, and then had his residency in internal medicine at the Philippine General Hospital. He finished his fellowship in Geriatrics at the St. Luke's Medical Center, and is now a clinical associate professor at the Philippine General Hospital. He is also the section head of geriatric medicine in the medical city. He practices in Cardinal Santos Medical Center, Manila Doctors Hospital, St. Luke's Medical Center, and in our very own CMI. Our second speaker will be Dr. Kristina Gutierrez-Rubio. She is the Vice President for Medical Affairs and the Medical Director of CMI, so we're truly honored to have her giving a talk today. She finished her Doctor of Medicine from the University of the Philippines. She had her residency in internal medicine and fellowship in rheumatology, both in the Philippine General Hospital. She finished a postgraduate fellowship in the Johns Hopkins University School of Medicine. Very well trained, really a very smart doctor. A consultant in internal medicine and rheumatology in the Makati Medical Center, the Medical CT, and VRPNC. I think they're now ready to begin their talks. Please prepare your questions. They will have a lot of interesting things to say, and I'm sure you will have a lot of questions you would want to ask later on. So let's begin. Can you turn me over now to Dr. Abat?
Okay, good afternoon, everyone. And thank you for having me over this afternoon. And thank you to CMI for facilitating this activity and sponsoring this activity. Okay, so let me just start my slide set. Okay. So this is indeed a very challenging time for everybody. Okay, this is the first pandemic that I have personally experienced in my lifetime, and I'm sure, like what Dr. Hazel has said, this is probably the first one for a lot of us. Okay, and it is a challenging time to care for our older persons who we know have challenging health conditions to take care of, and then we have to deal with this pandemic while taking care of them. So hopefully at the end of this presentation we will have a good idea or a better grasp of how to take care of the health of the older person during the time of COVID-19. Okay, so here is the outline for our talk or for our session for today. So we will discuss some concepts on aging so that we can better understand what changes are happening to the body as we age. We will deal with COVID-19 in the older age group. And then finally, we'll be discussing how to take care of the older person in the time of COVID-19. Okay, so some concepts on aging. So aging is defined as the accumulation of changes responsible for the sequential alterations that accompany advancing age and the associated progressive increases in the chances of disease and death.
We can't see your slide.
Oh.
Can you present your slides?
Oh, sorry.
Thank you.
Okay, so again, this is our outline for today. So like what I mentioned, aging is the accumulation of changes causing sequential changes or alterations in the body and are associated with progressive increases in the chance of disease and death. Okay, so what does that mean? These changes happen at different levels in the body. So these changes can usually start at the genomic level or in our DNA, and then is translated in the epigenetic level or in molecules higher up the biochemical processes to more complex biochemical processes that are later translated to changes in the organs and the tissues of the body, and finally translating to changes in your health status. Okay, so these changes actually lead to consequences that increase the chance of disease and dying. Okay, so like what we mentioned earlier, biochemical composition changes happen to different molecules inside the body. and it causes physiologic changes in the body, which are much more different than what we are used to when we were younger. Like, for example, we do see people complaining that when they are getting old, they cannot do things that they were able to do before. Like, I've had patients who complain that it's difficult for them to do jogging at a longer distance anymore, like compared to when they were 5 years younger. So those are some of the manifestations that they feel when they are aging. All of those changes, as they accumulate, lead to a decline in homeostasis, meaning it leads to a decline in their ability to compensate for stress or for any stimulus happening from the environment. And this leads to an increase in susceptibility to diseases. Okay, and of course, as you grow old, as you accumulate all of these changes, and as more vulnerabilities occur, and the more you become susceptible to other diseases, that increases your chances for further morbidities and possibly dying. Okay, so we've discussed some of the basic changes that happen with aging. Now, it is obvious that when we go around the community, there are people who are old by their number of years, but they function quite well. And in fact, we have seen this in our community. We have seen patients who are in their 70s, in their 80s, but they are still quite beautiful, very functional, very active in a lot of activities. They are very intelligent and very outspoken. Okay, so it seems that they are functioning as if they are younger. Okay, on the other hand, we do see other people who are in their maybe late 40s or early 50s or even in their 60s, and yet are already suffering from a lot of diseases and are already functionally limited or debilitated. So comparing these two sets of people, we now go into the concept of the difference between the chronological age and the biological age. So chronological age is basically just the number of years that a person has gone through in his lifespan. Whereas the biological age is the actual level of functioning, actual level of physiologic capacity that the person possesses that may be correlated to a certain age level. Okay? So chronological age does not necessarily translate to the same biological age in all people. So you may have different biological ages for a given similar chronologic age. Okay, we've discussed the accumulation of changes in the body as one ages. Okay, so these changes affects your physiologic reserve. Okay, so what is your physiologic reserve? Your physiologic reserve are your resources in the body, your bodily resources that enable you to withstand stress. Okay, and as you age, this physiologic reserves decreases. And even at the start, your physiologic reserve is different at baseline. And this is due to a lot of factors. Your genetics. Some people have good genetics, so they live longer. They're able to withstand diseases much better, or are able to get over infections much better than other people. But as age increases, the amount of physiologic reserve decreases. And the amount of physiologic reserve that you are using to maintain health stability increases on the other hand. Okay. Now, what happens when an insult or a problem happens to an older patient? Okay, it now depends on the amount of physiologic reserve that is available to overcome that stress. When that stress surpasses the amount of physiologic reserve that we are able to muster, then we go over the cliff. And then that's when all of the problems happen. You become debilitated, you get sick, you suffer from the manifestations of disease, you suffer from the atypical manifestations of disease, and possibly increase the chance of you getting hospitalized or even dying. This concept is what we call homeostenosis. It is the narrowing of the physiologic reserve available in the older patient to get over stress or be able to get over any abnormal stimulation. Okay. Now, this looks like a very fairly complicated chart, but what we are just showing is a person who has little vulnerability or is at a minimal risk would have to suffer a lot of problems before they suffer a lot of manifestations. So this is this part of that chart. A person with low vulnerability will have to suffer a lot of problems before they become debilitated, for example. On the other hand, older persons who have many risk factors already at baseline, they have a lot of diseases like hypertension, diabetes, they already have osteoporosis or a lot of other diseases. They only need a small amount of insult for them to become problematic. So even a minor cold or a minor gastric upset can cause a lot of problems in patients who are already very vulnerable. Okay, and the extreme situation of loss of physiologic reserve is called frailty. We do see this in a lot of patients. These are the patients who got sick one time at the start, and then they progressively deteriorate until death in a very rapid amount of time. So frailty basically refers to the loss of physiologic reserve in a person, and it is an inherent vulnerability to the challenge from the environment. There is no fixed age when frailty happens, but of course, what we always say, the more you get older, the more frailty happens in an older patient. But frailty is not necessarily dependent on age, on the diagnosis, and on a lot of other risk factors. Okay, so this looks like a busy slide, but I will expound on this or simplify this for you. Okay, all older patients start at point number 1, wherein you don't really have a lot of risk factors. But as risk factors develop, you will lose your health trajectory, or you will have to go to a lower health trajectory. And when you get sick, you may have to settle for a lower functionality, or you may become debilitated, or if interventions are given early enough, you may be able to get back to your previous trajectory. But most older individuals actually go at a lower health trajectory and they deteriorate more rapidly. So, what is COVID-19 in the older age group? We do see patients with similar signs and symptoms as in younger patients, like cough, shortness of breath. You do see patients surprisingly have diarrhea, and a lot of patients complain of loss of taste or smell. Older patients already have a loss of taste or smell at baseline, but this becomes more pronounced when you have COVID. And you can see the comparison of symptoms with other common diseases particularly in this season, like colds, flus, or even allergies. What we want to emphasize is older patients suffer from atypical symptoms like lethargy, confusion, they become suddenly disoriented, or some of them may actually have increased sleeping time. They spend most of their time in bed sleeping and become unresponsive. Some patients actually start suffering from frequent falls. So when your older person starts to have frequent falling compared to maybe a week ago when they were really quite stable, then you have to suspect something is happening. Okay, and as you can see in the US, hospitalizations, admission to in the intensive care unit, and death is much higher for persons in the older age group. So that is just one thing we really have to avoid. You have to prevent older patients from sustaining COVID. Okay, and this is from data from the Philippines. As you can see, there are a lot of older patients that also suffer from COVID. And as you can see, the death rate or case fatality rate of older patients suffering from COVID increase of almost 2 to 3-fold as you get older, to as high as 15 to 16% between the ages of 80 and above. Okay, so we go to the last stretch of our talk, which is how to take care of a older person in this time of COVID-19. Okay, Hand washing is particularly very important. If you really want to prevent the virus from getting into the body, hand washing is very important. We cannot overemphasize that. 20 seconds hand washing is still very important. Okay, staying at home. You don't want to bring the older person into an environment that is full of COVID, so it's always best to stay at home. It's very protected. The home is a very protected environment, assuming your other family members don't bring the virus inside the house. Okay, if, as Dr. Hazel mentioned earlier, there are other older persons who really need to go out and cannot stay at home because they're the only ones in the house and must take care of themselves, then they have to protect themselves by wearing masks and goggles and other protective equipment. Of course, coupled with that, they have to practice social distancing. So when they go out, they have to observe the strict 1 to 2 meters away from other people, and as much as possible, avoid going to gatherings with a lot of other people, and use technology just to converse or communicate with other people. Okay, vaccination is important. We want to prevent other diseases that may complicate this season of COVID. So we want to lessen the chances of flu, pneumonia, or sometimes even diphtheria by giving vaccination to our older patients. And these vaccines have been proven to be beneficial for older patients. Okay, having a comprehensive geriatric examination is important to determine the risk factors an older patient has with regard to his health. So what does it entail? Having a detailed history, having physical and neurological examination, cognitive evaluation, behavioral evaluation, and down the line. In nutritional evaluation is very important because we cannot overemphasize nutrition in maintaining the health of the older person. So what interventions can we give? We have to manage all of the person's diseases adequately. So if the patient has hypertension, diabetes, we have to manage them very well and keep them under control. Nutritional management is very important. We have to ensure that they are taking enough calories. We have to make sure that they are taking enough vitamins and other micronutrients, and possibly give them supplementation and other nutraceuticals. Okay, exercise therapy is very important. We have to maintain muscle mass in a lot of older patients. So personally, I always recommend strength training in older patients. So older patients should lift barbells. You should also do cardiovascular deconditioning and flexibility, especially to prevent falling. Okay, mental health and stress management is very important. All of the previously mentioned modalities may induce a lot of emotional problems like depression because you're isolating the older patient. So we may have to provide venues to reduce stress and prevent depression in older patients. And I think that is the last slide. Thank you for listening, and thank you for attending again this webinar.
Can you hear me? Dr. Mark? Well, I have, before I proceed to the next speaker, I just have a clarification. Yes. On your very interesting initial part of your discussion. You mentioned physiological reserve.
Yes.
That is our body's reserve that allows us to handle the stresses around us, right? I mean, in simple terms.
Yes,
okay.
That's
so I think a lot of the people I know, they consider this immunity because they always say, how do I increase my immunity? When what they really, really mean is that how can I face all of these infections around me and protect myself? So what you're saying, it is, we build up these reserves over our lifetime. It's not something that you only do today in the time of COVID. It's not like you take and start eating all the fruits and vegetables today because you're afraid of COVID. It's actually how you strengthen your body all your life.
Yes, that is correct. Although we have to emphasize that short-term interventions may have some benefit for some patients. But again, we do agree that our physiologic reserve is built up over months and over years, not just at a single point, short point in time.
That's a wonderful point, because that's a big thing about preventive medicine and good lifestyle. It's something that we have to do so that whatever pandemics we face in the next decades, we will be able to handle them. Okay.
Yes,
And on
correct.
that note, we're going to go into our next speaker is going to talk about life after COVID and preventive medicine. Let me turn you over now to Dr. Krista Rubio. Thank you, Dr. Mark.
Hello, good evening. Is it? Oh, it's still afternoon. It just looks like it's evening here because of the rainy season. Thank you for that great talk, Dr. Abat, Mark, and I'll be discussing now life after COVID. So this is something that a lot of people are asking themselves, that I admittedly am asking myself as well, like what's life going to look at like after this is all over? And specifically, I'll be discussing how we take care of our seniors in terms of their medical care after COVID. And if you have any other questions about other aspects of their care, that we can discuss that during the Q&A. So, okay, so we all know that we're having an aging population, but a lot of our seniors nowadays are actually still very productive. They're, like Dr. Hazel said earlier, is that they're leaders in their industry. A lot of them are teachers. A lot of them are still taking care of even more older seniors. So they still need to be pretty active. And to say that they have to stay home and to limit them in this way, it can be a very hard to accept. But I think that because of the current situation, we're really going to have a different mindset, and we're really going to have to make adjustments in the way that we live our lives and the way that we seek care. And that's really what we will be discussing today. So how can we know based on Dr. Abat's talk that COVID does continue to impact older adults disproportionately. I learned a lot during those few minutes that the reason why they do develop more severe disease, why they're more likely to get hospitalized, and their increased mortality is really due to what Dr. Abat discussed, which was a lower physiologic reserve. And also, our older adults are more likely to be impacted by disruptions and delays in non-COVID related care, preventive care, and care of patients with chronic conditions, because they are most of these older adults are the ones who do have chronic illnesses. So the main question really is, how do we care for our seniors today without putting them at risk? Okay, and that's what we will discuss in the next few slides. Okay, so the medical care, whenever you're caring for seniors, or if you're a senior yourself, when you're making these decisions, you try to keep three things in mind. And your primary goal today is to reduce the risk of getting sick, because of course we do know that we're in the middle of pandemic, but you need to balance that with timely management of chronic conditions. And you also need to remember that there are still some essential preventive interventions that you need to prioritize and not put off for too long. So Dr. Abat discussed this already, that of course we all know this, it's being drilled into our brains for good reason, because in the middle of a pandemic, without an effective treatment and without a vaccine, these are really the primary ways in which we can prevent ourselves from getting infected. And that's what was discussed earlier: stay home, wash your hands, social distance, so keep space between yourself and others about 6 feet or a meter away, keep away from people who are sick, so stock up on supplies, so try to limit your trips outside the house so that you don't have to go out very often, and of course to clean and frequently disinfect touched surfaces. So Dr. Abat did mention that when you do have to venture out, you need to wear protective equipment. So the primary one that we've been advocating for is for everyone to wear masks. And I know I put the slide up because I do see a lot of people wearing their masks incorrectly, pulling it below their nose or under their chin, or removing it and then putting it back without washing their hands. So before you put on your mask, you need to make sure your hands are clean. The white part is the one that's, well, it depends. So the colored side is the one that's facing out and the white side facing in. You loop the straps around your ears or over your head if you have the tie parts, and then you fix the metallic strip to fit the shape of the nose. And then you stretch the mask to cover your chin, and then when we're wearing it properly, then your protection is guaranteed. So, and then if you need to remove your mask, if you touch the front of your mask, you have to wash your hands. And then when you remove the mask, you only touch the ear loops and the ties, and then you dispose of it properly. So how do you care for your mask? So it says over here, as soon as you put on your face mask, you should avoid touching it. Only touch the sides when you need to reposition it. Avoid putting your mask on and taking it off too often. When taking off your mask, only touch the elastic bands or ribbons. Once you have taken it off, wash your hands thoroughly. If you do need to take off the mask for a short time, like if you need to take a drink or if you're going to have a meal, then you can place it on a clean surface that you can easily sanitize, because the assumption is that the front of your mask is dirty. So you put it down, the front side down, or you put it in a non-permeable bag, an air permeable bag. And then the mask should be changed every 8 hours or every 4 hours if you use it intensively. So if you're talking a lot with your mask on, of course, it can get wet. So you need to replace it. If you're using a cloth mask, you need to wash it at 60 degrees after every use using detergent. The mask must be completely dry before you use it again. And then choose a permanent clean place for your cloth masks if you're using cloth masks, and preferably you store your used face masks in a sealed fabric bag, then you wash along with the mask if you're using a cloth mask. And then do not touch the clean mask once it has been washed, and then you only touch it when you're about to put it on to make sure that it stays clean. So that's just a quick discussion on masks. So aside from reducing your risk of getting sick, again, you need to timely manage chronic conditions, and you need to prioritize essential preventive interventions. And the reason we need to do this is because, the first wave of diseases will really be the acutely ill, the ones who get sick from COVID. But the second wave will be those who are impacted by, the restriction in the healthcare system being able to cater to people with non-COVID conditions. And then the third wave will be those with chronic conditions who, generally are stable, but because they don't get the regular care that they need for their chronic conditions, then they also become sick. And those are the things that we've been starting to see. Like, you ask any doctor, they'll tell you stories about, patients who, who are rationing their insulin or, not visiting their physician, and they end up getting sicker. And the reason why we don't want you to have interrupted care is because if you wait too long and you come in too late, then you will be sick and you will end up in the emergency room. And those are the things that we want to avoid, because ending up in the emergency room just increases your chances of getting infected. So for how has medical care changed for seniors during and after, and how will it change after the pandemic? So these are my suggestions, and these are the other things that you will see in medical care moving forward. So I personally believe that all seniors, and actually all patients with chronic illnesses, should have a care plan that's actually advocated by the CDC, and we'll discuss what a care plan is. And I think even now, because it's harder to just show up at your doctor's office, it's harder to communicate with your relatives, you really need to have that care plan with you, and you need to communicate that with your family and your primary physician early on, so that even before you arrive, they already know what you have, they already know what your plans are and what your wishes are. And then telemedicine is really becoming the primary way in which we are trying to deliver care and give access to patients who will, who might have a harder time visiting the clinics, or might, be purposely avoiding going out of the house. And then, but it's important before you seek care to plan and coordinate these in-person visits when you do need to go to the hospital. So this is what a care plan looks like. This is just downloaded from the CDC website, and it's really just a description of your medical conditions, your medications and what they're for. It has a list of your physicians and what they're treating you for. So you have your cardiologist there, your pulmonologist there, and how they can be contacted most quickly. And then you have a list of your caregivers. So you would put my child as my primary caregiver, or my wife, or my husband. And then you would ideally also have advanced care planning, wherein you would let you would decide for yourself and you would have your family know what your plans are, who are, so that, that this is all ironed out, just in case, so that, you're prepared. And then you would also actually have plans for follow-up and emergency contact. So that's your care plan. So that's what you would use, and that's your preparation before you start to see, do your medical visits in the new normal. And what does it look like? It's really going to be, telemedicine is really going to play a bigger role. And there are lots of advantages and limitations to telemedicine. So one, it's convenient. You can see your doctor in your pajamas if you want. You just wake up, turn on your computer, and you can start your consultation. It actually increases your access to other specialties, like some places that are remote where they don't have a neurologist, they can finally see a neurologist in Manila using telemedicine. Ideally, you should also have access real time through telemedicine for urgent care consults and for a doctor to help triage you to the appropriate level of care. And of course, the biggest advantage in the pandemic is that it limits face-to-face visits and patient travel. However, there's some, limitations and some disadvantages. You really need, the doctors and patients need technical training to do this. You need to have a little bit of know-how on how to use your laptop, how to turn it on, how to use all those new apps that are coming out. That there's so many new platforms for telemedicine. You need good internet access, or if there's no internet, you need a good phone line. There are a lot of technical and equipment needs in order to have a good telemedicine consult. Another disadvantage is that it really sometimes reduces continuity of care, because patients, we know as physicians, we do know that patients like to shop for doctors, and telemedicine will just make it even easier. And if you keep seeing or calling a different doctor every time you have an acute problem, it's very difficult for somebody to see the big picture and manage your chronic issues more appropriately. Of course, the number one disadvantage for doctors is a very limited physical exam, because the PE is really so important to us. We do see a lot of important clues in the physical exam, and we really, for some specialties, it even makes telemedicine almost impossible. So there are certain specialties where they really rely a lot on the physical exam in order to get a good diagnosis. And of course, another big disadvantage is that it's very difficult to establish a good physician and patient relationship. Sometimes, because of the impersonal nature of being on the phone or in front of a computer. Ideally, when you're ready to start telemedicine, is that you need to find two types of telemedicine services, especially for older seniors who have limited mobility. One that's on demand, meaning if you have an urgent issue, you can call them that day, and that's very important, because gone are the days where you can just walk into your doctor's clinic. That's not going to happen anymore, not in the near future. So you really need to have somebody who you can access quickly. And even just to find out, do I need to go to the ER today, or can I just wait this out? Those are important things that you need help with. And because it could save you a trip to the ER when it's unnecessary, but it could also help you seek care when you really need to prevent a worsening of your condition. And of course, you also need somebody, as scheduled types of consults wherein you can prepare and address all your issues with your physician and more comprehensively. So tips for great telemedicine visits. So please schedule your teleconsultations. A lot of doctors have been generous in the pandemic by giving their numbers to their patients, and it's very difficult to remember, sometimes, or to plan if you just send them a message out of the blue. Sometimes you're trying to remember what did I prescribe? Because, we physicians, sometimes we need to prepare for these consults, and we like to be prepared when we talk to you. We want to have our chart in front of us so we can look back and see how we took care of you the last time. So please schedule your teleconsultation if you can, unless it's an urgent concern. And then right now, before the teleconsult will occur, expect to receive a consent form, which details the limitations of a teleconsultation, and there'll be a lot of items in it, and you should please read the consent and contact the clinic or the physician beforehand, before the scheduled appointment, if you have any questions. Now, for you to make the most out of your teleconsultation, because they will have limits, you won't be able to chat with your doctor for an extended period, as you prepare your list of medications, your recent diagnostic labs, and other documents you may need, especially if you think that your physician has not had access to their clinic because of the lockdown. So it would be very helpful if you could prepare that ahead of time, and you may even send it to your physician electronically if you're able to do so. When you're going to do your teleconsultation, choose a well-lit room that is quiet and free from distractions. Of course, prepare your devices so that you have good audio, video, if you're going to use video. And then it's useful to have some medical tools with you. You can have your own automatic, blood pressure monitor. You can check your temperature for your physician so they can see that if you're febrile. You can even bring a flashlight. Sometimes they'll need you to shine the light on certain areas so that they can examine it more better. And then, of course, take down notes. Before the exam, you can write down what you want to discuss with your doctor so you don't forget anything. And then make a plan for what will happen if you get disconnected, so how you get connected to each other again. And then make sure to remember to ask for your prescription and your requests. And of course, you confirm your follow-up plan. And the follow-up question will always be, are we going to meet again on teleconsultation, or are we meeting in person? So those are the things that you need to clarify after your visit. Of course, I need to emphasize that if you feel severely ill, or if your doctor advises an in-person or ER visit, please do not delay seeking care, because that's something that we've seen in the last few weeks, is patients calling and calling, and you can hear that the patient is feeling worse and worse, but they're so afraid to go to the hospital. And if a physician says, I cannot adequately assess you over the phone or on teleconsultation, and you do need to see a doctor, it's really best to listen to that advice. It's better to be safe, because if you do wait too late, you will come in more sick, and it's more likely that you will be grouped in with the really sick patients or even COVID patients. It's better to come into the hospital as an elective walk-in admission than as an emergency room patient. So it's really best that if your doctor decides that you need to see a doctor, or you need to come into the emergency room, or you need to be admitted in the hospital to comply. Okay, so when you do need to make an in-person visit, how do I know that it's safe? So a lot of clinics are in the process of this lockdown, making changes, and a lot of them are environmental or engineering changes, and they're also things like changing the ventilation, putting in HEPA filters. And then a lot of the changes will be in the way you can enter the clinic or the hospital. Gone are the days of walking in. All hospitals, clinics will require appointments, calling ahead. And this is really to shorten wait times and for them to be able to do crowd control. You will get screened. Some hospitals and clinics are able to screen you before you arrive, but a lot of times they will still want to screen you when you get to clinic. And then they will be, of course, doing infection control measures, such as having everyone wear masks, because you expect your physician to be in PPE. So if you have maybe a child, or you're coming with somebody you need to prepare your patient that the doctor will not look like they did the last time they saw them. And then some procedures may not ever be done anymore in clinics because of possible aerosolization. So that's when you need to see a doctor for your chronic care. But there are also a lot of preventive services that you really need to continue, such as mental health, cognitive health, and substance abuse counseling. You need to, talk to your doctor about fall preventions, check for functional impairment, assess home safety. All these things are important for seniors to remain healthy. Of course, for seniors who are relatively healthy, we need to catch the disease also before it becomes worse. So we need to screen for chronic diseases, for cancer, and of course we need to do vaccines. So some of these preventive services can still be done remotely, like you can do the counseling remotely, you can give fall prevention advice remotely, but of course certain things like some of the screening tests will need to be done in clinic. And it's better to plan for these visits ahead of time. Of course, vaccines will need to be done in person. And for elderly patients, it's really a yearly flu vaccine. 65 and older, you really need to have a pneumonia vaccine. A lot of older adults would benefit from a shingles vaccine, and a lot of older patients do need an update of their tetanus and diphtheria shots as well. Okay, so this is just a summary of the required vaccines, and you can actually download this off the CDC website. And then, of course, this was already mentioned by Dr. Abat, we need to emphasize proper nutrition and exercise to stay healthy. And for seniors, and not just seniors, for all of us, we really need to battle social isolation because it can really increase, worse outcomes in patients who are sick. So we really need to find ways to connect to each other and to stay connected even during lockdown and during this time of quarantine. So I just included the slide because, and I think Dr. Hazel touched on it, and Dr. Abat touched on it also before, is that, the reason why our elderly patients are not doing so well is because we really need to, as a society, revisit how we can support healthy aging so that when, crises like this occur, our more vulnerable populations are more able to withstand the pressures or the stress that come with it. So with that, that is actually my last slide, and thank you. So I'll stop sharing. Okay, great, thank you.
Thank you, Dr. Krista. We are getting a lot of questions, and may I also have Dr. Mark on the screen so that we can begin our question and answer. Dr. Krista, may I begin with you?
Yes.
We all understand that patients really want to avoid hospitals and emergency rooms these days. But cough, cold, fever, these are common symptoms. And there are many things that can cause it. You have flu, you can have bacterial pneumonia, which are the fears of the elderly. So tell me, and let's tell the audience, how do you know it's COVID?
Well, right now, there's really no way to tell it apart just based on symptoms. Before, we would rely on exposure. Exposure history was one of our primary criteria to increase our suspicion of whether this is COVID or not COVID. But because we are in the stage of sustained community transmission, right now, a lot of patients who do present with acute illness, the thinking is it's COVID unless proven otherwise. So right now, the thing is you will probably benefit from getting tested. That's really the only way to differentiate if it's COVID or on one of the other acute illnesses.
Is the nasal swab.
Right.
The test,
I'm sorry, I can't, you got cut
the
off.
testing is the nasal swab.
Yes, it's a nasal swab. It tests for viral DNA, RNA actually, because the virus is an RNA virus, and it lets you know if you are currently infected and if the symptoms you're currently experiencing are due to the COVID virus. That said, there's sometimes, of course, if you wait a little, if you're feeling pretty well, like maybe on the first day of your cough, you can see, because sometimes other symptoms will appear within the next day or so that give you more clues on whether this is COVID or not. But in the first few days, there's really no way to tell them apart. That's why if you have, for example, an older patient who has risk factors like heart failure, and then they do get a cough, and the patient has been home for 2-3 weeks, we doctors know in our heads that this is most likely just bacterial pneumonia, right? But we also know that a senior with risk factors at home with bacterial pneumonia is already high risk and does still need to, be attended to in the hospital. So as patients, you will just have to expect that your patient will still get tested for COVID, even though your physician is already treating them for something else that they believe is the more likely diagnosis. Maybe Dr. Abat also has something to add.
Yeah.
Yeah.
I do agree that community transmission is already happening. So we really cannot totally rely on the possibility of the exposure of the older person himself or herself as a clue that he or she may have COVID. That is one reason why we consider all of the symptomatic patients who come into the hospital as as possibly COVID suspects because the infection might have been brought in by the relatives. And that is why we do emphasize also in the preventive measures that all of the family members should be wary of doing hand washing, protection of themselves also, because they don't want to become asymptomatic carriers or spreaders and bring the infection to the older person.
Yeah, thank you. Thank you, Dr. Krista and Dr. Mark for that. I think we just have to emphasize to our listeners that just being a senior is a risk factor. It is, and then you add up hypertension and diabetes. So you sort of increase all your risks over time. Now, I do have a lot of senior friends who tell me, I have not gone home, gone outside of the house since this lockdown. Yeah, sure, but your household members have been going out, buying groceries and doing that. So it just increases the risk. And sometimes when you suggest, somebody calls you, they have fever, and they say, I cannot have COVID, I haven't gone out. But you just have to listen to the doctor when the doctor says, we have to test you because you are not in a bubble and people could be bringing the virus to you at home. Now, which brings me to another question, Dr. Mark. One of our listeners, how do you protect the senior in a multi-generational household? I mean, in the Philippines, we have everyone living in the same house, or in the next door, you will have the children and the grandchildren. How do you just keep them in a room?
Well, if you are living in quite a nice house with multiple rooms, then it's easy to bring them to their own room and set it up such that there can be some social distancing in the way they interact with other people. But essentially, yes, isolate them. The problem happens when you are in a smaller house or possibly maybe a one-room condominium or something like that. Then it becomes more difficult. So the senior may have to use personal protective equipment like face masks within the home itself, and strictly emphasize that your household members should avoid getting infected themselves and should practice infection control measures like hand washing and wearing of the mask also to prevent acquiring the infection and spreading it to the senior.
Okay, thank you, Mark. So, fearless forecast, Dr. Krista. How long is this going to be? When can I start hugging my family members again?
No, this is, well, it wasn't me who said this, somebody else, but we don't make the timeline. The virus makes the timeline. So, I mean, I know it's heartbreaking to think because I also have senior parents who miss their grandkids and until we have better control of it. Like, I mean, there's hope out there because we are seeing reports of countries with 0 new cases, with lower and lower new cases. And once we're in a level where we can determine that the virus is, the infection or, its transmission is controlled, then we can start to listen to, guidelines on how we can be able to interact more with each other. Because the thing is, the virus is not naman in the air, but it needs people to stay in our community and to interact. And actually, if we are more obedient, I don't want to say obedient, but if we're more able to comply with stay-at-home orders earlier and rigidly, it actually will not be able to transmit, and eventually we will run out of patients with the virus who can transmit it within the community. So until that happens, or until a vaccine is available, it's really hard to say when. I'm hoping, I haven't seen the latest numbers. When I look, they haven't gone down yet. So it's probably not going to be in the next month. But I think that we just need to find more creative ways to interact with each other, right? To check in with each other. It really needs to, because I know that that's really how we show each other that we care. Because, I mean, we miss each other, but of course we don't want to get each other sick. And that's really what we're going to have to accept as our new normal for the time being. So.
Dr. Mark or Dr. Krista,
yes.
somebody in the audience is asking, I think it's Dr. Krista who showed the slide on the vaccine
Oh yeah, I
schedule.
can share it again.
I know there are actually physicians who are worried that if a patient gets vaccine, they have a fever. And then, quote, you wouldn't know anymore if the fever is from COVID or it's the vaccine. So might as well postpone it, which I think is outrageous. But how do you convince families that vaccines are more important now than any other time?
Krista, would you want to have a go at it, or shall I go?
You can go ahead,
Okay.
and then
Okay. Okay. Most febrile reactions from a vaccine occurs maybe around 4 to 7 days from the vaccination. So that's usually the most number of days that you may suffer from fever. So I would just suggest maybe take a antipyretic during the time that you had the vaccine. And if the fever recurs and persists for more than 7 days after the vaccination, then it's a different story. It's probably not vaccine related.
yeah,
Yes, the doctors should be able to differentiate
Yeah.
fever coming from vaccine and fever coming from COVID or other infections. And
Yeah.
so after the infection, I guess you're supposed to still follow up with the doctor who gave the vaccine and still report if there are any symptoms. And we should be able to know if this is something that we should be worried about or it's really just a vaccine reaction, right?
Yes, agree. Most fever from vaccines is fairly mild. So, and in COVID, it's usually much worse. So we should be able to differentiate that.
All right. Thank you. Dr. Krista, maybe you can post the vaccine
oh yeah, I
slide.
can post it.
Yeah.
Here, let's
Somebody
see.
asking, I think they missed it. Is herpes zoster the same as the shingles vaccine?
Here you go. So, so the shingles vaccine is the zoster vaccine, yes. So for older, the ones in yellow, those are the vaccines that older adults are actually, yes. So the yellow blocks are the ones that are recommended for those age groups. So if you want to look at 50 to 65, an annual flu vaccine, and you need to, we don't have the live one anyway in the Philippines. So the ones that you will be getting in your, in clinics will really be the inactivated vaccine. You're supposed to get the TD or Tdap every 10 years. And then for older adults who are prone to getting shingles, yes, you can get the shingles vaccine. And then this is the pneumonia vaccine. So we get a lot of concerns about whether they can get it when they're younger. So that's something that you can just discuss with your physician. If you're a smoker, if you have heart disease or diabetes, then definitely you are a candidate for the pneumovax or the pneumococcal polysaccharide PPSV23 vaccine. And then some adults can actually get both the PCV13 and the PPSV23. So that's something that you can discuss with your physician.
Okay, that you spent a lot of time discussing telemedicine, Dr. Krista,
Yes.
and I have here questions almost the same things. Like, for example, how do I know that the hospitals are actually disinfecting their CT scans and mammograms and sound, and I will not get because the COVID patients are also getting CT scans and the COVID
Yes.
patients are ultrasound. So how do I know that I don't get it?
Ideally, there should be a true separation between infectious patients and non-infectious patients. I mean, that's in an ideal world. Definitely, we'll just have to. That's what hospitals have been. They've been, following guidelines and creating protocols so that they can do their best to disinfect. They try to sometimes they do it in terms of days, like if or areas. I mean, physically they're separating areas, but you're right, in terms of some diagnostics there may be some overlap. So a lot of doctors are in certain hospitals, they're just deciding to limit these procedures just so that they're avoiding, interactions between patients. But the virus dies with proper disinfection. It's not going to be stuck to the CT scan indefinitely. Actually, it can even die on its own without disinfection after several days. So, sometimes hospital infection control committees are able to make plans so that they can avoid patients getting it. You're really actually less likely to get it from a surface than from an actually symptomatic patient. So you're not as at risk from the CT scan compared to if you're in the room when they're doing intubation, or if you're at home or talking to your relative and they're not wearing a mask. You're actually more at risk from a person who's infectious than from the particle that got left behind. So.
Okay, we will be running out of time, but there's so many questions. I just have a few more burning things to ask. Dr. Mark, how do we protect ourselves at home? Do we have to have UV lights installed? Does everybody have to have a face shield at home? Do we have to spray sanitizer every hour? Tell me, how do we tell our viewers what they should do at home?
Well, there are really no concrete ways to protect you from the infection, except, of course, for you not to bring the infection home in the first place. So, again, number one is stay at home as much as possible. And then when you go out, use protective equipment. Before going in, disinfect yourself, take a bath outside the house, clean or wash your hands, remove all of your contaminated clothes, and again, wear protective equipment, isolate your high-risk individuals in the different parts of the home. Basically, that's it. UV lights, it's an optional thing. I mean, there are a lot of available equipment. You just have to make sure that those are reliable. Yeah, basically, that's it. Hand washing is still one of the best ways to prevent infection from coming in.
Yes, amazing that we talk about everything UV lights when this is a virus that dies with soap and water. Yeah. It's really not something that you need to buy. You just have to keep cleaning your hands, hand washing and cleaning everything. Dr. What is it? Dr. Krista, one last question. You mentioned nutrition. You mentioned exercise. What in simple terms, what do our seniors, what should they be doing to arm themselves and protect themselves against COVID?
So generally, just what you would normally do to keep healthy, you eat a balanced diet and you exercise outdoors, ideally, of course, with a mask on, but you do need to get your daily dose of sun and vitamin D. And you do need to exercise because it helps prevent falls, it builds up your, helps with your balance. Those are all very important. And you just need to find creative ways to do it, even though we're all in lockdown.
How long exercise?
So the exercise they say is, well, ideally you would build up to 30 minutes 5 times a week. So that's 150 minutes of cardiovascular exercise a week. But you also need to do strengthening 3 times a week. And you would also need to do balance and flexibility. Sorry?
Sun exposure?
Sun exposure. So that's something that there's always a debate of sun exposure for vitamin D versus protecting you from skin cancer. But I do like you to get at least 20 minutes of bright sun, like after 10 a.m. Yeah, so that you can activate your vitamin D reserves to help with your bone health. Because of course, seniors are more prone to osteoporotic fractures. If you're unable to get sun exposure, then definitely you can supplement. So this is the only group where I do recommend supplementation. Seniors do sometimes need, if they are, have been found to have a higher risk for osteoporotic fractures, then they do need calcium and vitamin D supplementation.
Okay, so how much vitamin C, how much vitamin D?
So that depends, right? So vitamin D will depend on, ideally we would test your vitamin D, and if you're depleted, then we will do this catch-up dose of vitamin D to get you at appropriate levels. But then there's several thousand international units depending on your yes, depending on your ideally we'll check your levels and then we'll replace it. And then calcium, it also depends on certain factors. Sometimes patients who are already osteoporotic or osteopenic, you would need more calcium and more vitamin D than patients who are not. So that's something maybe you need to discuss with your physician.
All right. There are so many questions. I think they are on Facebook, and I think CMI will be able to answer them. We'll keep Dr. Krista and Dr. Marc in contact, and so that we can answer some of your questions on Facebook. It is a new normal. I refuse to accept that to this day. I am an optimist. I think we'll be out of this in a few months. I think we should be able to travel again and have family reunions again. And one of the, if you try to look positive, think positive, staying at home allowed us to be closer to our families, if virtually or physically. I think grandparents who live with their grandchildren are able to spend more time with them, and so those are the lucky ones. But there are those who live alone, and when they're living alone, they feel they're so detached, and they couldn't wait to get out of this lockdown. So this is an unprecedented event. Occurrence for all of us, but we should not lose hope. As a neurologist, I'm looking at your mental health, everyone. Let us try to see the positive side and be optimistic. There will be a vaccine. Scientists are racing to develop the vaccine and treatments, but in the meantime, we just have, as our resource person said, we just have to be more creative. Use Zoom and all of that, and interact with your family members and friends. Check on each other every now and then. Continue your Viber chats, and so share jokes, and then time will pass. And once the lockdowns are lifted, we do it very, very slowly, very, very carefully. We protect ourselves. We wear our masks, and just remember that physical distancing is not emotional distancing. That doesn't mean we should be away from each other and start being nasty. When you have a mask between the two of you, then that means you have to exert more effort to be more emotionally connected. And we younger children should remember that our parents and our grandparents are scared after we say that they are very at risk. So we just have to tell them that we are here to take care of them. And I think by just attending this webinar, then they would know that we really want to make sure that they're healthy after this. Okay, so we will continue answering your questions on Facebook. Thank you so much for joining us in our webinar today. Please stay at home, stay healthy, stay safe, and see you again in our next CMI webinar. Thank you.